Hello and a warm welcome to D14 Broadcasting Public Service, incorporated broadcasting from District 14, Montserrado County, to all of Liberia and beyond. We are a community-based public broadcast service on a mission to empower our local communities and the nation through active engagement in media, education, and information sharing. At D14 Broadcasting, we believe in the power of media to uplift and unite people, and we're here to inform, inspire, and encourage everyone tuning in. On this platform, you'll find a rich variety of programs and stories tailored for the general public, all groups in Liberia. We bring you up-to-the-minute community news that keeps you connected to what's happening in your neighborhood. We offer educational programming for young and old alike, helping to enlighten minds and build knowledge. Our content addresses important social issues head-on, including discussions on substance abuse, prevention, and recovery, as well as empowerment segments for women and youth, and fun enlightening shows for kids. You'll also enjoy uplifting religious content that nurtures the soul and cultural outreach programs that celebrate Liberia's rich heritage and traditions. Whether you're a student, a parent, a teacher, a community leader, or anyone in between, there's something here for you. We are uplifting, warm, inspirational, and encouraging in everything we broadcast, because our goal is to bring hope, knowledge, and positive energy into every home. At D14, we pride ourselves on being accurate, balanced, and credible in our reporting, and we don't compromise the people's interest. As a community public broadcast service, our team of independent reporters and producers is dedicated to bringing you nothing but the truth, reporting stories just as they witness them on the ground. We may be a small team, but we are passionate and committed, for as small as we are, we remain accurate and want to grow with you, our beloved community. Every segment we produce is guided by our mission to empower and educate. We are here to shine a light on local voices and engage you actively in the stories that shape our community's future. So get ready to be informed and inspired. This introductory program sets the stage for an enriching experience with D14 Broadcasting Public Service Incorporated. Stay tuned as we dive into stories that matter, share knowledge that empowers, and spread messages of hope and unity. D14 Broadcasting Public Service, incorporated, serving District 14, Liberia, and beyond, is on the air. Welcome to a broadcast that's for the people and by the people, where your voice is our inspiration and your community is at the heart of everything we do.
Ladies and gentlemen, I do apologize. The show was mistakenly turned off, and we back on. Sorry for the inconvenience. They no mistakenly turn off the show, so I have to put it back on. I'm trying to get Melvin on, and Joe himself are trying to get on. So yeah.
Oh, you get people from Canada working with District 14 Broadcasting?
Yeah, they're happy. So, Beno, what's the update? What our plan for tomorrow, and what's the update for today?
Yeah, but today the president for Cloud Liberia.
Mm-hmm.
You know Liberia?
Yeah.
You get me?
Yeah, I know Liberia. I get him.
Yeah, so I how we talk today. I told about the show. She said she got pest.
Hey, Benny, you're nowhere today again. Your network is about to drive on nuts. Your network is about to drive on nuts.
In Liberia, there was the
Oh, that's sad, Danami. That's sad, Danami. That's awesome. Yeah, that's the thing. I don't know whether it has to do with the form or the location, or it just aqua. So you have to drop and come back because I don't think you see. My man, let me focus on my show later. Yeah, let me focus on the show. Oh, so we're waiting on our co-hosts, our panelists, and the guests. We hope, like most often, when the arrangement to have the guests, here, sometimes it's difficult, Liberia. But we're trying our possible best to ensure that stability comes to this show. I know it's challenging, and one thing I good, I have thick skin when it comes to that. I can go over the test of time, and we'll do it gradually till we can find the actual people to fit in. Like our society, sometimes, most of them, we got those that just follow the way, and those that have the ability to lay the ground work. So we trying to make sure that we have everything into place. You know, So we're hoping to have the other people joining. The Tuesday, you got to provide the network stability. Welcome back, Melvin.
Thank you, Joseph.
So you the coordinator for CDC now?
Yeah.
Okay. Congratulations. I didn't know.
Oh, okay. Thank you. But Baron
Yeah,
didn't tell you?
eh?
Why did Baron didn't tell you?
Because I don't get deep into party politics. Yeah. I
What?
I got that discipline. I don't get deep into party politics. I got all my people from every camp. What I believe in is just common thing. Yeah. I don't know. I'll probably be part of, our Liberty Party partisan, right?
I
But
know that.
since Councilor Bronsky passed, my taste of politics, especially on political leaders for a political party, have reduced until then. I voted, trust me, I voted, but I can't. You're the BB people, my man. We're looking up to you. But give us some of what you intend to give us, and then we can dive into the issue of kush, the sustained issue that battling our brother there, and what we can do. But you can talk a little bit about what happened yesterday. Yeah, but don't be too hot, don't be too political now. Just get a synopsis out of beautiful how you work on our big brother and other things like because I gave the
So
chair, you want, yeah, you
so
want like
so but then
that deep.
Chester, you can say tell me what is happening and you say Melvin, don't be political. You don't expect me to be religious in saying it. So
No,
basically to just wait now, man. If you take your own, let me take my own please. To just give us synopsis. We went to the airport and people gathered from the surrounding districts in Montserrat County and closer the airport from Angibi, Boston. You know, we are his popularity. So we are, and nobody goes to a popularity a contest in Liberia. It's unarguable. We are is the most popular politician in Liberia. So people will always stand up jubilantly. We saw the grandstanding. Let me use the word of the Secretary General. The grandstanding from the Liberia National Police yesterday. But we are being who he is. We never expected anything else from what he said. He always spoke about peace. So basically, yeah, we struck and our own national headquarters. That is one of the reasons why he had to come back to the country. So yes, everything relatively on course. Teacher number 14 is relatively on course. The people are here. So far, so good.
so when you're hoping to do the groundbreaking of the headquarters? You have yourself on mute. Yeah, you me yourself just now on mute.
Okay, I said that uh, that that is going to be announced by the committee, the 24-man
Okay.
committee that have been set up by the political leader. Yeah, so since the president is in the country now, and they will come up with the official announcement on the groundbreaking ceremony day. but I have no idea right now.
Okay, that's good. So one of the things, like I said, we're expecting the cook Jack, and that arrangement was done by Joe, and we hope Joe be able to get in connection with him. Because one thing we try to avoid, not just going to people, they might commit themselves, because we can't put you on the flyer and we can't do that and you're not turning up. And we got to be very excessive in getting to our people and getting there. A lot of people, I believe, would like to come here and talk about the district. And one of the things is that they sure going to expose us publicly to the country. And especially when we're speaking on issue, we believe at a certain point in time, our information will be going out there and people will be able to come in to give that support. So we shouldn't overlook the platform. And this is one of the biggest things we can use in order to promote our district and find solution. Like for Monday, we spoke, and Melvin, and I think you one of the person, we spoke about, look, everything, I always say this. I got my political interest, but I always look at the developmental aspect of everything we do. And the representative can't do everything. What can we do as a people? So one of the things we look at, and maybe we all born and grew up over there, right? And let's just take, for example, how long that bridges been over there and just been woody. So what our strategy in order for us to change the bridges to cement? And we had a conversation a week ago, and we lay on it because we're expecting to get a couple of youth maybe by next week morning, and let's find strategy how we can do it. Maybe right as a district team, just all the young people do one letter, we all sign it. All the young people there, because I'm not young man again, they all sign it and they submit it to Simeco, National Port Authority, LPRC, all the BB businesses, requesting for certain kind of material based on that company. Where Simeco, we look at, first thing we need to assess how many breaches we get there. From the Long Beach, the breaches all the way beyond Doe community area, going all inside like to Bella Mansion area, there, all the breaches there. And we found we need to just find one engineer who assess everything and be able to come up with a quote, an estimate based on the then we can drop the thing. Maybe we say, look, Simeco say, yeah, Simeco, can you give her like a 2,000 bag of cement? Simeco, can you give her like 2,000 bag of cement? And okay, a certain brother, can you give her like 2,000 steel? Okay, Fulani brother, can you contribute the amount to sustain the workmanship, not the community, but the engineers that are coming to work along with us? National Port Authority, can you provide this so we can get plywood, get steel and preps and other things? That would be something good, but like we have to collectively agree upon that. But that is not the topic, like I said, right? We will be focusing on the sad part is the kush and other drug substance and the clinic, what are medication there, what can we do in order to have medication available for the clinics and what have you. So all of that is very important in our surrounding and outside surrounding. Baby, you gotta touch the sound. You got sound on. You gotta mute yourself until you're ready to speak. Baby, you need noise, right? Baby, your noise in the noise in the background. So Beno, when the people of a lot of people talking and there's a noise in the background, we don't want to we don't want to get too messy, people listening. So sorry that Brian dropped, and we hope he gets back. And Beno, I hope your network, like this is something I think we have to adjust this show, because the time we chose is not really working for us. Everything look bad aspect to the attendance, aspect to like the network. I believe because at this time when everybody home, the network gets actually bad because everybody using internet, and sometimes I don't know, like when it comes to the capacity of network in Liberia, I actually don't know. So, but I believe it create that buffering and other thing because a lot of people on small internets, or maybe I would say maybe gigabyte that supply other people at time. And yeah, I don't know the capacity of Orange. I don't know the capacity of Lone Star, but yeah, we'll do some time adjustment. Actually, we'll do some time adjustment to get this much better. And our goal is to continue on the show. Anything that serves as a obstacle, we must be able to work on it. And the guest is not on. Okay. So Benu, what are some of the like health related? We're talking about kush the last time, other something.
Joe just sent message in the chat room, boss.
Yeah, I responded to him. I
Oh, okay.
responded to him. Yeah, and maybe that because I sent the first link, and according, I don't know whether he using. I sent it to Jack too, but I don't know whether he actually seeing that link. Yeah, so
You will see it.
yeah.
See, Orange, Lone Star, everything bad up.
But Benu, we can. Is that possible? We look at the true adjustment.
So what time?
4 o'clock can work.
4. See you. 4 will be soon.
Yeah, but you know, in another one, everybody on the internet, so it actually give problem. But let's keep trying as always.
Yeah,
Yeah,
let's discuss it with the team now.
yeah. If it fall, it'll be soon here to myself, or maybe we can push it a little bit. I don't know, but okay. Formula is on. Mama, you say you're not be here today, oh?
It may have changed.
Yeah, probably like class.
Okay.
Yeah. So yeah,
Yes, you, you're
welcome,
asking
man.
question. Welcome, family. I'm saying hearing also. From the focusing when I was in Georgia.
Benu,
See you,
are you sharing the link? Where I gotta share the link. I think that one of the things we're missing recently, we're not sharing the link there.
I share the link most of the chat room. In all
The,
the district 14 chat room, I can share the link.
no, I'm
Yeah.
talking about today. I'm talking about like to John. I'm talking about the one.
The one you can click on the get on the show.
No, not the Facebook one.
Yeah, the Facebook one, yeah, I can share too. I can share it and I put on my Facebook page.
Okay, yeah. All right, we gotta share. We gotta
Yeah.
see if people get used to this. We got. There are a lot of things we have to take flexibility. We got to look. There are a lot of things we got to. If family is talking, it means that you're on mute. Yeah, you're on mute. I see you are. We can hear you. Okay, you just. Yeah, okay, you're off mute. You're on mute.
So, boss, I mean, you get problem. I go to the thing to go.
Why did you call up Jasmine? I mean, what you say? Pamela, you know, the chairman talking, but let me mute
Yeah,
till you
boss.
get better again.
Yeah.
You get a chairman on the ground talking, but better. Okay. Pamela, you went, you gone, you stuck. Okay, Melvin is back.
But no one hearing from there, yeah. Oh.
Yeah,
I think you
application
never
of
too.
probably stuck. You know, he using probably a data gap issue. Okay, the guest here, Dr. Jack Abenigo. Welcome, my dear brother, to D14 Public Broadcast Services. And this is District 14.
Okay, thank you, Lawrence.
Melvin back.
Yeah. Now, Lawrence, that Chester. Lawrence,
Oh, Honorable Nings, how are you?
my dear brother, long time. Not Friday.
Okay,
Yes.
thank you. I've been around too.
Thank God. So you
Okay.
are our guest, you are our special guest today on this show. And
Okay.
our topic for today, we surrounding health and health awareness, where we talk about the health related issue in the district, our present clinics, medical issues, and what have you. So today on the show we have Brown, Melvin Brown. We have who is our guest, intending to be a panelist very soon. That's why we force him, because he invests in time and other things, and that's the kind of thing we need. We need people who see this as their own. And honestly, I would like to leave this show very soon and leave it with people, but I have to make sure everything order. And Joe is gradually growing and getting bigger as well. So we get Joe on the show who invited you, and that's a responsibility. And myself, we have Lauren, who is the host as well. So you're welcome. I don't know whether the information was shared properly as per to what we're going to be discussing today, but I believe you have an insight on it. So you're welcome, my brother. You can introduce yourself.
Okay, thank you to you, Honorable Nings, and to Brother Joe De Sosa, former president of Doe Community Youth Association. And I also want to use the time in my own distinguished honor to also say thanks and appreciation to Melvin D. Bryan for also voting on this District number 14 platform. And I'm also grateful and want to extend thanks and appreciation to you, particularly Honorable Niece, for such an initiative. And it is my first time to appear on this platform, and I believe, like you initially stated, that as to whether the topic was rare, share with me, yes. The topic was actually shared with me today when Joe called me. I was in my study room and when he told me about this, and I embraced it, even though I received the topic and tried to figure out what was the main essence of the topic. And he said there'll be a lot of health matters. We'll be discussing environmental matters concerning sanitation about our district. So I took keen interest about it. So I'm honored to be on the show again.
Okay. Dr. Jack, let me give you some insight. We'll be talking
Okay.
about just abuse among young people and rehabilitation efforts, community health centers, and access to care,
Okay.
prevention health, malaria, sanitation, mental health. Yeah, that's the three breakdown of soft topic. Yeah, when
Yeah. So
you check the flyer, we posted all we have photo that is what we have on it. So the host is back. Welcome back, Laura. We have Jack Abenigo on, and we have Melvin as well. We have our Lieutenant Joe and Beno, So, and we have Dr. Jack. He introducing himself and probably want to go a little bit into what we're about to talk about.
Okay, Chester. So, by the way of introduction, my name is Jack Abeningo To, Direct Resident of District number 14. I'm a general practitioner and been in the field for a length of time, decade plus. Currently, I'm trying to wrap up on my second bachelor in nurse anesthesia from the Lutheran University in Swakoko, Bon County. And I'm honored to be on the show. So, to these issues that are just listed, drug abuse among our youthful population in district number 14, and what are some of the rehabilitative efforts government have put in place to see how best to curtail or to mitigate this issue. And relative to that topic, I would like to begin at this. District number 14 is one of the 17 districts in Montserrat County.
I'm not hearing anything. I'm not hearing anything. I don't know.
Oh, there for you. It's for you, Melvin.
All of the sound.
It's for you. If you're not hearing anything, it's for you. You got to check your.
Anything.
It's for you. Probably need to reboot your phone.
Yeah, you have to find either earpiece or something to connect yourself.
Let me cut it off and rejoin.
Yeah. Okay, sorry, Jack.
So can I go ahead?
Yeah. Sorry for the
inconvenience. Yeah, listening.
Yeah, you can go ahead. Go ahead, yeah.
In the 17th district of Montserrat County, are you getting me?
Yeah, we do.
Hello.
We do. Yeah, we do.
We getting you.
Okay.
We getting you.
Yeah. So. Okay. So relative to drug abuse, district number 14, in fact, is one of the smallest districts in the 17th district. And but status, you gotta know that
we pay attention. Maybe there's a
Maybe the network to giving hard time.
Yeah, network. Lawrence, you got anything to say?
I just wanted to listen to the introductory statement from the guests.
Okay.
And then we can all begin asking questions, because what I think we need to do is, when we have a guest on the show like that, one of us as panelists can come up with our questions based on the topic on discussion. So I wanted to just listen to an opening statement, and then we all can go around to ask questions, and then we move on with that. But I think the network is giving hard time.
Are you getting me now? Are you getting me? Hello?
Yeah. We getting you. How you above?
I think Fred.
We getting you.
I think Fred suggested something the last time. Maybe at the end of the day, we'll have to maybe consider it about starting early, and then because he said, according to him, at this hour around 7, 8, everybody home now, everybody on that network. So maybe probably that time the network can be jammed. And
I don't want to say that, and we're just discussing that.
Yeah, that could be one of the reasons why the network. Yeah. So we can, but we'll discuss it behind the scene as a team after here. Then we can consider what time we can adjust to.
Okay. All right. Thank you. Jack, you can proceed. Jack? Hello? Yeah, the network issue. I think Jack is.
Is he in Monrovia? Is he in Monrovia?
Yeah, he in Maria. No, I think he in because he was talking
Because
about.
I heard him talk about Bon County.
Yeah. So
No, he said
welcome,
I
channel.
think he
How
based
many
in
is
Bon
there?
County.
Oh, he got himself on
Eh?
YouTube. Let me see.
How many is there?
Okay, yeah,
Hello?
he there.
He on.
I think
We
it should
listen
be the
to you,
terrible
Jack.
issue of the network. It should be
Chag
the issue of the network.
is in town. Chag is in town.
Hello?
I can firmly say that.
Hello?
Okay.
Am
Yeah,
I on?
Jack, we hear you.
Yeah, we are
Yeah,
you.
the network issue is since to being
I
barren. So
know.
like I was saying, so I'm
Okay.
grateful to be on the platform. Jack Abenigo is my name, and I'm direct rector of district number 14. I'm also pleased to be here to share my own expertise to the various topics concerning district number 14. So can
Thank
I
you.
go ahead now, Brother Lawrence? I was just
Yeah,
Yeah,
trying
go
to read.
ahead.
go
We
ahead,
listen
Jack.
to
Go
you.
ahead.
Yeah.
We're
Okay.
listening to you. We want you to just give us all that you've been involved in with, especially when it comes to around the topic we are discussing. What has been your contribution? What you're doing right now, and how we can tap into what you're doing to make our district better. So go ahead. We'll listen to you. Then we'll ask you a question later.
Okay, thank you. So certainly for me, I came from the perspective of health. I'm of a general health practitioner and I'm currently working on my second bachelor in next anesthesia from the Lutheran University in Bond County. So to the issue of drugs abuse, there are many pivotal factors that surfaces and we have to underscore them. We have to look at them technically. One of the factors that we relate to the proliferation or the direct abuses of drugs, most especially these illicit drugs in our district. One such factor could be family environment. Family environment could be one of the key factors. Family environment, for example, if we in our own capacity are restricting or are creating that discipline measures to our grown kids, giving them all of the discipline has a relate to upbringing, they won't be allowed to be brought under the atmosphere of peer pressure. They won't be allowed to remain out and get influenced by those who are already being abused. So particularly, family issue is one of the key problems. Another issue we should look at is the issue of abject poverty and unemployment in our district. For example, if you're having a family of four, where in that family the legitimate parents are unemployed, to the greater extent you will understand that that parent will not be capacitated to fully sustain that family in terms of parental responsibility. To the greater extent, you will have the family lacking in beyond when it comes to the issue about domestic maintenance. So the children in that family will be left out either by friends, by family member, and these influences will also play on our upbringing. And at the greater extent you will have that child or the children will be displaced and will be influenced grossly by either that environment or somebody who are being abused because of the inability of the family to maintain and curtail discipline in the family. Another thing we are talking about poverty, unemployment, like I already raised. If poverty will be some of the key reasons why abuses of drugs will continue to remain on the high or rampage in our district or community. For example, if in this family or if in this community, family here are not able to educate their children to the bad practice of abusing drugs, these illicit substances that continue to undermine our community or our district, that child or that children in the family will not be educated, will not be having the full awareness to reject who to make friends with, to know which gathering to be part of, to know what is evil and what is good for them. Poverty also plays a similar role. Another example we could look at is also about environment. Environmental factors tools always play. So, like night and day in our various schools, we're even having children who are minor, who are underage, are also did but yet and still they pretend to be students. So, environmental factor is one of the pivotal factor too we should look at. In our district number 14, where the issue about poverty and limited education is increased in district number 14. For example, you have vast majority of dwellers in our district number 14, who have limited education, for example, who have not even completed secondary school. Somebody who are primary school dropout, somebody who did not even go to school. So at a greater extent, you will have these children being influenced because of lacking of awareness of those illicit substances, lacking of education, poor performances of family, environmental challenges will be some of the factors. And what our government have done, what we do in terms of rehabilitation. In my mind, some of these strategic things government should do, empowering various health centers through the Ministry of Health, various community grouping through the city government, empowering high schools proprietors in terms of identifying or creating elaborate awareness on the issue of illicit drug abuse in our district or in our communities. If the government, through Ministry of Health or through local international NGOs, would see that very much prudent in terms of empowering local government, empowering community leaders, CBOs, high school proprietors, and even social grouping, creating that meaningful awareness by even visual aid, even drama in various schools. I think it will create the avenue opportunity, even though we cannot eradicate at this time, but we could get on the pathway of reducing the input. Another thing again, government should also empower, like they have always doing, empower Ministry of Justice through the Liberia Immigration Services, that community leaders who will be in the know of these illicit drugs. I can remember some years back, we used to have community watch forum. These people were not only knocking down criminals, they were also identifying or stopping harmful things coming into the community, harmful attitudes coming in the community, or harmful behavior. Like I can remember some years back, there was some grouping who prohibit the issue of one of the banks in the district to be burglary at the time. And these are all sensitive grouping that could help. If the government too, the Minister of Justice will empower LRS in our various districts, the influx of aliens and foreigners are also major factors to look at, because the exacerbation of drugs abuse or imports of drugs in our district, they now wholeheartedly came from Liberian ideas, but it also started from those alien and foreigner who came into our district to find dwelling place, not knowing they came on the pretense of dealing drugs. These were some of the factors that today you have drug abuse is high on the rampage in our district. Every communities have been affected. Every community have some negative impact to this issue of illicit drugs abuse and importation. So we can call on government on our other route, Ministry of Health, Ministry of Justice, to empower community leaders and district leaders, even through the office of the lawmaker, through the office of the township commissioner, because the issue of drugs, it is not only the government. Government has to play that part, and we, the community members, various youth grouping in the various communities, can have an awareness movement or an awareness team that will be responsible to create sensitization and awareness, to create or to identify people who will be misusing the space provided for dwelling. Instead of dwelling, they are marketing illicit drugs, they are importing illicit drugs. These issues should be aligned at this favor community grouping. I think in my mind, there will be some of the progress we'll be making to mitigate, to limit, to reduce the illicit aspect. And when it comes to the aspect of rehabilitating those who are already been abused, like this man who are already been abused, rehabilitation program through the Ministry of Health, because they are already been traumatized by drugs. Ministry of Health can come in through the health team in the district. Those mental health programs they will create, community members can partnership with them, making sure that we identify our brothers who did not even go into the issue of being abused willingly, but they were influenced through peer pressure, through issues that self they didn't understand, because they were influenced by those who were higher than them, those who were older than them, those who have the knowledge and couldn't have prevented them from exploiting their self and preventing their future. We can work on them. In my mind, there will be a step one. Hello.
Yeah, we getting you.
So to the second aspect I have to the second topic that have to do with environmental health, healthcare, sanitation, malaria. I don't know what I uncles because he only tested the topic of me, so I just copy head instead of me writing it down because I left my other phone back because it was down, so I left it on charge.
Okay,
So we can
let
bring
me
it up to speed with the
let
second
me look
topic.
into it to help you out.
Okay.
Yeah, let me help you into it. Sorry for that. Like, yeah, sorry for the late notice as well. So the next issue on hand is community health centers and access to care. So I don't know whether Lauren just get back, whether you want to ask you a couple of questions on the drugs abuse, or maybe any of the panelists or the co-hosts want to ask you a question on the drugs abuse among young people and the rehabilitation effort. I don't know whether they got any question. Then we can go to the next one. Lauren, am I in line with you?
I feel Lauren is yourself.
Okay, you can continue. Maybe when we fall back, then we can probably ask you question. So the next one is the community health center and access to health care in our district.
Okay. Yeah, so looking at the population of district number 14, district number 14 is hugely populated. About 63,000 plus is a huge number. And looking at the landscape of district number 14, it is very small and overcrowded. And district number 14 have been overwhelmed with macro swamp, flood eviction, and other disadvantageous health issues. So looking at the Clarendon Health Center now, Clarendon Health Center then used to be the Clarendon Clinic, have been a very instrumental space of health where vast majority, if not 90% or 70% of the populations in our district go to that health center to seek health care. And other peripheral clinics who are owned by private entrepreneurs are also rendering services to relieve our citizens from these diseases. So the issue of health in district number 14 is also a pivotal one. It also issues tools to be looked at. Because looking at the invasion of flood during the rainy season, looking at poor sanitation during the dry season where there is no perfect drainage system that will help to create that perfect emptying or drainage to the ocean that will help to relieve the people from so many health issues that are surrounding the district, ranging from industrial effects, where we have that of industry creating industrial pollution, also creating problems for dwellers in the district, like the cement coal, like the flour mill, the premium flour mill, the distilleries, alcohol centers, LPRC, metal law, the zinc factory. These are all environmental pollution that complicate the already health problem, the already health rate. District number 14 dwellers are ongoing because of the congestion of population and with the overwhelming population focusing on only one health center. And sometimes they have been constrained in terms of financial situation to relieve themselves to go and fetch to other private health centers in terms of health care. So these are problems we should also look at. So some of the factors that are leading to that. I can remember some years back, our then representative tried to create another health center into community. Up to this time, that health center has not come to full fluential. Reason to that, some of us not know yet. But the Clarendon Health Center have been overwhelmed with a lot of cases coming from the various community, looking at over plus 12 community with inhabitants of 63,000 population, where 70 to 80% only look at Clarendon Health Center to go for care. It is the only government health center in our district, even though there are other people who may be capacitated in terms of finances will go out of the district in terms of care. But to the vast majority of those who don't have, who just go to the Clarendon Clinic and do that normal thing and get that normal treatment on the care to patient basis where there will be not too much money spending because it's a private facility. So they also underscore some of the diseases because of poor sanitation, no perfect drainage system, the congestion during the dry season, the industry that creating a lot of health risks. Let us look at some of the diseases our dwellers in the district suffer from. For example, from the issue of poor drainages, because it's a cleanliness is worthiness. If you are not, even for your own house, if you are unable to give your house or even your bedroom a decent facelift, definitely yourself you'll be even breeding mosquitoes, you'll be even breeding rats that will come and feed on your digits, that will come and feed on the dirt you have created. To the larger extent, those mosquitoes in the net will come across you and will create malaria. And malaria in our setting, it seems to be malaria is one of the key. Hello.
Yeah, we listen. We
Okay.
listening. We listening.
Okay. Malaria is one of the diseases, most especially that children under 5, pregnant women, our disadvantaged young people who are already being abused for the issue of substance abuse, they don't have dwelling place, they encounter malaria on a daily basis. So the Clarentine Health Facility, where it has already been overwhelmed, you will notice that some of our dwellers will not seek care because sometimes they don't go soon, sometimes they don't have the financial support to meet up with those little demands Clarendon Clinic must post to help to keep the facility running. Malaria is one of the problems through poor health sanitation system. Another one we could look at diarrhea, because cut across our district, there are not many houses that have been built having a decent flush latrine. Vast majority of the houses over there, they are still having that archaic way of living where you will be 10-room house, there's no bathroom, no toilet. To the greater extent, even tenants in that house will be at the point of disadvantage. They will toilet in plastic at the extent throwing in one whole house and forgetting to know those toilet or those bad materials they had thrown in our whole house will recycle to the greater extent to affect them. They might come down sometimes with diarrhea, sometimes they will come down with typhoid fever, sometimes they will come down with malaria. From the industrial perspective, you have those industrial creating hazard, most especially this hazard on our human body. It has serious effect on the respiratory system, where we are already congested, we are already condensed in terms of population. The issue about little oxygen we feel on become limited for every one of us. Then we already have industrial effect, continue to suppress it, continue to dilute it. So with those pollution in the air, through inhalation, our lungs will have infected, we get infected, and vast majority of us who don't have the hand will come down with respiratory problem, either pneumonia, either bronchitis, either tuberculosis, because of those environmental pollution that will complicate the little oxygen we are breathing and will cause problems for ourselves, our family, and even to those who don't even have the dwelling place. Those who even if you now go to Clarendon Market, you will see them along the table. If you go to the cow factory, you go and meet them there. They don't have dwelling place. It become challenging. It become a greater challenge to them. So health issue is another issue too we can look in. So we could also call on health ministry through the offices of our local leaders, like the representative, like the Gaula District Commissioner, like the Clarendon Health Center leadership. We can talk it over to them, whether government in their own capacity could see it very much prudent, could see it very much important, like the way the structure are already been created in those community, as to whether they could work along with our district leadership or with Max leadership, because district number 14 is honored, but the health district is honored Max County, and it's honored Bourgeois Health District, to see as to whether they could elevate that health center that are already been created, the structure are already been created, that they come to Florential to help to give our people health services that will be able to reduce to little health challenges, challenging issue, that the pneumonia, the malaria, the typhoid fever, the diarrhea. And another way we could tackle this issue, we could create a community, very community health team or very community sanitation team. Like I can remember in Doe community, where there was a time Doe community leadership, Doe community youth leadership were learned with the first working Saturday that we team in labor has very broad day. That at that Saturday, all around Doe community, you will see the Doe community leadership, labor in a bed, having a shovel, giving the community a facelift. Those things in itself could reduce the issue about poor sanitation. Another one could be the issue about garbage control. Is one of the factors that continue to exacerbate those issues about health challenges or health challenges in our district. Go in our district now. How many public areas having garbage control system? How many schools? How many entertainment centers that after they have used all of that their material, the input of it, how they can recycle their garbages is another concern. Because looking at the congestion of district number 14, you have limited land space, the area is crowded up. You don't have the means where you have people having that individual institution, for example, to create that easy access to go to communities or to go to houses in terms of collecting garbages to recycle it. It's a challenge because we as people in the district, we don't have that means to do it. Also it poses huge challenges that complicates or that undermine our health issue. Poor garbage control or no garbage control, recycling of our own debt, the input of our material we use. These are also challenging aspects that complicate our health issue in our district. So looking at only Clarendon Clinic is overwhelmed. And to other private facilities that the EKG Edo community, like the maternal and newborn health center in the Freeport. These areas are private areas and the resources are exorbitant that even limiting other people who don't have the hand to go there. They only look up to Clarendon whenever they come down with those controllable diseases that should be controlled, because they don't able to respond in terms of seeking help at private facility. They allow those diseases to overwhelm them. So we could work around it one way or the other, advocating, calling on our district lawmakers, our local leadership, through the Ministry of Health, to help to activate that other health center, to help to relieve our people from those challenging health issues that can be resolved through the health patient to treatment means.
Okay, thank
So
you.
you
Thank
can come up with the next topic. I think I can stop here, and those who have questions, you can come up with your questions, then we can talk about it.
Right. Okay, thank you.
Yeah,
Daniel,
yeah.
do you have a
Thank you.
question?
Yeah, CEO, I got a question for him. I listened to him talk about the health sector and District 14, really lack of health sector. So, what is our next plan? We have to do it collectively. Every one of us has to put hands together. So, Jack, what is the way forward for us to get more health sector in the district? Because people can say district want us to boss or do not who for district they got two public health center. So it keep doubting me and look at the population in district number 14. And what all you just explained and what we really going through in district number 14, it comes to the health sector. So where's the way of health sector in the district?
Okay,
That's my
so
question.
thank you. Yeah, I got
Yeah,
your
you
question.
got a question. Thank you, Daniel.
What is the way forward to get more help?
Mr. Benigo, were you because Sano says that Mr. Sano says that he want to come in. Is that a question?
I want to give little bit recommendation to solution in what you say about the trust issues.
Okay, yeah, but can you allow him to answer Benu's question? Then we'll come myself want to ask you
No
some
problem.
Okay. Mr. Benugo, you're welcome. You can continue,
Yes.
sir.
So Beno, thank you. Thank you for the question. What is the way forward to have more health centers in our district to help to complement the effort of Clarendon Health Center, the only government health center in our district? One of the way forward, is by engaging our local authorities. Engaging them on these prevailing health matters on the prevailing health circumstances, challenges that we as district dwellers continue to face, whether during the dry season, whether during the rainy season. Each of the seasons has its own health challenge,
Right.
like I name. So by engaging our local authorities, like I said, district number 14 is one of the 17 districts in Montreal County. And Montreal County was just having a health arm for the Montreal County health team. And district
Okay.
number 14 is in the bourgeois health district. So if we can raise the grave concern to our lawmakers, to our local authority, owing to the fact of the prevailing health challenges and circumstances, recommending to them that we can work it out to Ministry of Health, or we can even start from bourgeois health district, Montreal County health team, before the Ministry of Health, collaborating with already health centers already have. Like the Clarendon Health Center, they still have their own challenges. So we can first take partnership with them, having a joint leadership meeting with them, inclusive of local authorities, having presented to them about these health challenges, and also listen to that side. Probably, who knows, as to whether they have their own agenda. But whatever the case may be, even if they have their own agenda, it is our responsibility because we feed the full weight. Vast majority of the population in that district don't have the financial capacity, don't have the education, like for you and I, to even create the necessary preventive measure. For example, to even sleep on a mosquito net. For example, to even get that surrounding clean. Because even personal hygiene, some of the district dwellers don't even have the knowledge to it. So these are basic things we can work around by engaging our health authority, engaging various community stakeholders, youth leadership, women leadership, the elder leadership, having a strategic health committees in each of our communities, working in partnership with our local authorities and that of the local health authorities before moving forward to Ministry of Health, before moving forward to Montreal County Health Team. I think they will have appropriate solution. If those solutions not even immediate, but they will give us the way forward where we can start from. Thank you.
Okay. Thank you.
Thank you. That was
Thank you, Jack.
excellent question, Jack. And one of the things I got from there when you spoke about the committee, I think it speaks a lot and it's a solution based. If you have a vibrant committee who can look at all the health challenges and be able to work on recommendation, that would be a good thing. I don't know, Beno, is that something that in the district health committee?
No.
Simon, do you have any idea on that? District health committee. Yeah, he's not only talking about the district alone, but it should be in each community apart from the district committee. Like for example, you have I believe maybe I'm not speaking clearly on what he said, but I think I'm trying to add value to it. Maybe each community, for example, the Basel community, they have their own health committee. Maybe 2 or 1 representative go on the district committee as well. So I think no, I'm just saying based on what he just recommended. With all he said about it, I think that's a way forward. That's a stepping stone. So thank you for that.
Yes.
Sano, you have anything to say? Then we can move on.
Yeah, leader, thank you. Like the issue of the drugs in the health situation that I talk about, I must employ contributed to some of the challenges, but a shortcoming one about solution. Really, You see our district like in Wellford going,
Okay, Sano, let me
poverty
just
is
say this,
speaking
right?
yes,
Sano, before you learn, the thing is that he gave some of the detail on the unfolding the challenges. We got to ask him the respectful question in order for him
Yeah.
to give us solution. He just can say all about it. And he gave some recommendation from expose if you listen to him keenly.
all
But
right.
let me give you the thing. I just want to like
Yeah, that means
disagree
coming with
with that
recommendation.
statement you made.
All right. The issue here is that the situation of trust and all of this thing that our young people getting involved into in the strong community is depending on the basis of high level of poverty rate in our district. When poverty rate increase to the higher high, it embarrass children to grow like in a district that you all know. There are some children just outgrowing, living with parents who are not start to provide sustainability yet. Have already born 3 to 4 children growing up. And the 3 to 4 children growing up is a challenge. It's a challenge to their survivability. You have to think about the child success, child future. To take care of a child is something expensive. But people born in randomly in a slow community area, and these children does not get a proper care, they don't grow up. That is another factor to the vulnerable society. So anything bad that is fall within a society, it's very easy for that child to consume it and becomes disadvantaged. These are another factor. And the second more thing here is that in our environment in Africa, like I can see, for clear, and I can tell every young man or every young woman, when you look in Liberia, 90% of Liberian citizens, they prioritize our children to go to school, regular school. And in regular school, when we go to it teaches us about job, how to find job. It don't teach us how to create job. In the end, the poverty rate, most of the beginners who graduating from high school does not even have something after 15 years. They does not even have something that they can start doing. And before they complete our high school, they inherit early responsibility. And those early responsibility they inherit, it block them from pushing further to get PSC. And a man who has high school certificate, it is difficult for him to get a job in our society. So when you look at our society, you realize that the Guinea people are not looking for job, that the way we cry on government. The Manugo picking are not looking for job like the way we cry on government. The Fulani are not looking for job the way we cry on government. The Nigerian, the Ghanaians, because they came with the fundamental aspect that entrepreneurship will pay better than job. They came with skill building, teacher education. In a teacher education, a man who born a child and a child reach 8 years in a mechanic shop. Before the child reach 14 years, that child will master repairing car. And that child can be able to live at that in the future. And that mechanic can even support that education soldier. Like for me, when I was coming up, when I got to 12, I was in laundry. I impregnated my girl. And my papa said, Sano, say you impregnated your girl, you're not being my horse. I'll be feeding you and be feeding again. And so the papa pulled me out. But one thing that kept me going and balanced me to become somebody better was the trade. The trade.
So
The trade aspect. The trade aspect is one of the aspects that keep me going. It was from the trade I managed to get a job, do the sale, and be able to do some things. for the community
Okay,
people. I mean, say
okay,
for my own life. So,
I wonder you speaking, you giving good study, and we all like
yeah, so we
it's nice.
encouraging people. There is something I'm saying. We have to encourage young people to involve themselves in their education to gradually overcome the high level of hardship that we inherit in our district. Because for the fact that hardship will be there, for the fact that poverty will always be in a queue, it's difficult and people will live that vulnerable life. Because the essence of taking jobs is because you don't get nothing doing the day. So you just go straight to the ghetto. 2, 3, 4 days time, you want to test what the guy doing it. And when you get involved, it leads you to your life to a place where you are not even expecting it to be. Because you stay doing the whole day, nothing to do. That's why you follow first. But if you are on a technical skill fee or you are on a vocational fee, you could have done better to be able to mitigate these challenges and overcome it. So for the fact that we young people, more especially in the slum area, we cannot overcome poverty, we cannot be able to survive independently, and we'll be born recklessly without no proper care. It will be difficult for us to overcome the issue of trust in our environment. More especially the DA are all one of the factors to the increase of trust in our country. The DA should be in a position to fight just like we got a trust agency in the whole community area covering the whole district number 14. These trust agency are aware of all of the ghettos within district number 14. And they are spent more than 2 years there. If that objective was anti-just to fight just, then why they keep holding on in breaking down those ghettos in the district? So it draw to their attention why their impact. Because since the day they there,
Okay,
when they were not there, ghetto was there.
Alaman,
Yes.
thank you, Alaman. Thank you so much. So now we hear from Joe, then we'll come back to Jack. Jack, you get it? You get Alaman?
Yeah,
Jack,
yeah, I have listened. Yeah, I listened to Alaman,
you
and
listen
I
to
listened to
Alaman?
him. Yeah, I've listened to him
Okay,
very
because
clear
of
and loud.
time, Joe, welcome. Joe, welcome. Joe, you getting me?
Right.
Joe?
I'm getting you.
Hello, Joe.
I'm
Okay,
getting
because
you.
of time, okay, I said welcome.
Thank you.
Okay. So I know you are following the conversation. Yes. You got anything to say? You got
Yeah.
any comment or any question to
So
Jack?
thank
Then
you.
Jack will come back.
Thank you, Bedun. Thank you. I'd like to appreciate you for the show, and I'd like to say welcome to Kenneth Jaga Beningo too for accepting our invite to appear on this platform. But
Okay.
I have few concerns when it comes to health wise. So I will take it bit by bit and ask the first question. When it comes to health, thank God you are a health practitioner and spend more than a decade on the field. And living with us in this district, I think you have been involved with some health activities here. So I want to know, and the follower want to know what is the. I'm getting some feedback though. What are
From
the
where? We get
major?
to you.
What are
Joe,
the
we get to you.
major? Yes, so I'm talking now. What are the major health problems that is affecting our district resident that you know about that the Clarendon Health Center or other health centers in our district is
Bro, I'm not
engaged with?
cutting or he spoke about everything relating to that. So we are the point of
Oh,
solution.
okay.
Yeah, he talked about everything,
Uh,
Jack. He talked lengthily, and his network was good. I'm so proud, and I appreciate them. He spoke about the jobs issues. I not just added voice to it. Just made very excellent point we need to look into. And Jack talked about the the health center and the health related care issues. So we're not asking question on drugs issue. We're not asking question on the health care centers and healthcare related issue. How can we move forward? Because he made many recommendations. He spoke on something very, very unique. He said the district need a health committee. And I asked, Sana, they said we don't have it. He said the health committee can be an alternative architect in order for us to resolve the health issue. So, and he spoke about us, maybe the facility, how we can maybe upgrade the facility or maybe rebuild the facility of the health center in Claremont and be able to take control of the health center in those community that was built by our former representative. But I believe in the recently he just told, he said that era Honorable Vamoya Kona based question. So that was a couple of things he said. He gave some detailed information regarding that issue. What are the causes and why? Because common hygiene, the community dweller don't have idea on common hygiene. These are things that we need to concentrate on and focus. So we asking some hard questions. What are the solutions? Right? What are some of the solutions you think we can put to the table? Right. And for me, one of my questions, Jack, and Sano just stated it. And now on the Sano on the shows, they said that the DEA people who are there are in connection with the guys then who setting the job. Whenever the me official office are going there to raid them, they inform them, and the guys then leave the environment. So I think one of my
people can give the information.
So I want us to use allegedly. Inform them.
Allegedly, thank you. Allegedly. Allegedly. Yeah, thank you for that. Thank you. Yeah, so Jack, we gave you back the floor. Maybe there's no other question because the thing is that the one of the panelists was here around, and Sanon was able to find some solution, which of course I took down. He said the issue we need to take TVET into consideration in order to reduce the jobs issue. So maybe we can look at vocational schools. People can learn skills and be able to leave the community rather than sitting somewhere and be pulled by peer pressure. So that's one of the things we can look into. So Jack, we gave you the floor, but sorry for that.
Okay, so let me say thanks to Salon, my brother there from the Freeport community. He spoke very much clear and well. All of his suggestions, these are similar things we have spoken to recently. Because it is obvious, we cannot have in our community one of the governmental agencies that are responsible to combat the issue of illicit drugs, continue to play laissez-faire, and even continue to remain to be some of the smooth collaborators and less collaborators with those drug dealers. These are concerns. So the issue about responding or setting the foundation of our district, rewriting the history of our district through the foundation of health, through the foundation of rehabilitating those illicit drugs abusers. It is a new phenomenon. It is a new foundation, and working towards our successes, we have to be very much innovative and pragmatic, because we are at the fundamental process. Like I listened to Benu, it has not been established in our district where we will have these necessary health committees who will also help to inform, who will also help to create those positive awareness, who will also help to identify those bad and dangerous health practices in our rural community. So it is sensitive. It is good that each health committee, like the CEO was saying, that we could have a team or health team in each of the community. Then at least one or two persons could serve on the district committee or the district health board. It is a new idea, and I believe with our collaborations with all of the key players in our district, we can achieve this.
I'm coming and go.
We can achieve this.
Oh, I feel lazy.
So another issue that Sanon struck about, it is important. It also put many burdens on the society, largely the government in particular. For example, our privilege to have served as one of the facilitators to some of the teenagers workshop around Liberia. And one of the fundamental or one of the responsible factors that also point finger to the issue about population are not taking into consideration the aspect of vocational and technical education. It is the issue that have been brought down to family environment, like I was discussing, the inability of the family to recognize certain age range, they're in the teenager stage. From 6 to 12 years, these are golden age you don't play with. If you must invest, meaning that you must invest in your child or your children during that ages. From 12 to 18, the World Health Organization speak about sometimes 20 years. If you as a parent will not be able for your children or your child to live up to the discipline, the parental discipline, up to the age of 20 years, the possibility of that child becoming a positive influential in society, the percentage is 10 to 90. For that child to become a wayward is 90% as compared to him becoming positive in the future. So these are things we have to look at. Sexual reproductive health and abuse. These are another factors that continue to complicate the already burning issues that is surrounding us in our district. So Salon struck a good point in the question that was raised by Benu. These are all good points, CEO. We can have those various strategic health committees because there's the embryo stage of everything. We can start to work towards it stages by stages. Get the committee. I want to agree with Salon concerning the issue about the influx of those illicit drugs. We cannot just jump into the picture of raising concern on these government apparatus who are then stationed in our various community or district in the need of working in the interest of reducing those illicit substances. We cannot just jump that boat. Like we can start from the initial process, work around our various community, make it possible for us to have these various teams in our various community leadership. For example, like during the Ebola time. Hello.
Yeah, we listen. We listen.
Yeah, we get.
Yeah. During the Ebola time, when our closest situated in the district, I was living in a community called the Pijo Garage in the Freeport community. Guess what happened during that period of Ebola? Where Ebola was an outbreak that hit Liberia for the very first time and brought a lot of exposure to our weekly health system. To that extent, even people who did not even come down with Ebola, people who were just having those common symptoms of these diseases that are just outlined, like the malaria, the typhoid, the diarrhea, low blood pressure, high blood pressure, these people was turned down. I took all the challenge. I and my team, I formulated a health team in my community, the Peugeot Garage and the Freeport community. And we were rescuing our people relative to those who were not having those detected symptoms that were associated with Ebola. But from my expertise, I have known that these things are not associated with this Ebola symptom that we are discussing, but these are their mere symptoms that we can handle. So because of that committee, I was able to save vast majority of the district population. Like I can tell you for free, people were even coming from those community to meet me. And through the special grace of God, with my team member, we were able to release some of them. We were even doing delivery in our very community because the population were under fear that the issue of Ebola was very alarming, was first of a kind. Some people were still in the stages of denial. So they were not even taking into consideration, even go to any health center. When they go there, they were thinking that it was going to be called, or that sickness was going to be labeled as Ebola. So it is essential we have those health committees in our various districts who will serve as a payload to combat a lot of health issues ranging from healthcare,
Okay.
going to the issue about illicit drugs abuse, and even rescuing those who have already been abused, creating the rehabilitation
Okay.
method or mental health to prevail on them, to rehabilitate them, to reverse them back into the positive of our society. Because we cannot sit back as a district dweller having a lot of expertise and say we want to wait on government. I'm very grateful, CEO. Honestly, this evening, when Joe called me and said, "Oh, I want you to appear," I was like, because I usually do topics on these things and facilitate to other institutions. So I was amazed and happy that indeed we having a functional or formulated institution that we can channel those educational tools to help our people in our district, because we cannot sit by and say Liberia will progress or Liberia will make progress in 10 years to come. What are we doing? I think these are some of the foundations we can start to prevail on. So holding those health
Okay.
committees in the various
Thank you,
community
Jack.
is important. Thank
Thank you.
you.
Thank you so much.
Oh,
See you.
oh, yeah. According to Jack, is a very good friend. One, we are professional. We communicated one or two times. We kept it on a professional level. And honestly, I may tell you, my brother, like, when I see people have the passion, like when you just said it, that chill bomb just caught me. We like you said, we got a lot of professionals, a lot of great people in the district. But what the issue for me, the issue is the disorganization pattern, right? The disorganization pattern, one the level of selfishness and self-interest is the reason why we're not making progress, and we politicize everything in the entire district where everybody know about the young people when they come here. They got some young people there who focus, but the one who are have the intellectual ability that need to transform that intellectual ability into substance that will help us, and not looking at things from all political corners, we will do better. Like you said, I will applaud you every Tuesday like this. We want you be even the main panelist for this and create more topics. And we come on the show, we invite other people you can help. We can invite other people they can come in. What we can do to like get our district together when it comes to health awareness issue. Like one of the things you said today, Joe, we partnering with Joe Institution, the Slum Community Dweller. I will recommend that we design a letter. I'll do the letter here, the partnership letter, and we submit a letter to the commission requesting for the district committee, and we'll be able to. One of the things I need to do, Joe, we need to get lists of all the communities. We need to do that. We need to do that in order to know what we're targeting. And one of the things that we're trying to do to see how well the commission can come on in communication, are trying to make sure where I can talk to Marco Tobesin, he can come on, a representative can come on. We talk to Ban, we talk to John Sylvester. We look at, like, tomorrow topic, we'll be talking about entrepreneurship, right? And we will be going for local business marketing, women, and anybody marketing. Let them come on. Let them come and just talk about how they make progress, how the business processes. And honestly, my brother, if anything will do for us to keep here, we want to. Just to manage the Tuesday show and be able to educate the young things. And let's start finding recommendation of each of the soft topics you just spoke about. Let's find recommendation. We cannot do it like you said, and other us saying it on the platform. We can keep concentrating on all the representatives need to do this. You need to build latrine for all the pay in the one at our. You need to connect this even when the electricity go up, they're waiting for a representative or one politician to can't do it. We gotta take self-responsibility. And me, I'll be honest. I want to be, if I will lead a district, I can lead a district where total liability.
Yes.
Because when the total liability, it becomes an issue. They will just keep electing the wrong people. John can't waste the money. Paul can't waste the money. And they will just see it that the way life's supposed to be like. So that Western syndrome, we left it after the war. The war ended. Let be our own capacity if that won't sin. Like I will tell you, like some of the hygiene things you spoke about. One young man sent me a concert note, and because I put it out, there's a committee. I said, when you come out with a concert note, anything, entrepreneurship, anything I can improve the district, you win the award of 5,000, which of course I still got it. And you remember, if you were in the district, all those are in the district in the 80s. They used to get it, all millionaires used to go from house to house, take the garbage and put it in the wheelbarrow and go trash it. Every Friday, they get a financial committee that will come and collect the money. He talked about it right now in my mind that one of the things among all the, I'm supposed to expose it, that one of the things I would take first for us to work on, because that will reduce the diseases and provide a clean environment. And one of the things we have to encourage, look, their platform we have, we need to sensitize our people. Sensitization is one of the biggest things. I want people, even if you find someone doing that, they will not even able to save that $25 or $50 every week to give to that person. And that will also create job employment. It will create job employment because if you have young people going to school and doing that, will be able to pay their school fee to colleges, not school fee, but will be able to take them back and forth, get a station there with other things, and also clean the environment. But our community people not willing to pay that welfare syndrome. We got to kill it. So it's just my point. I will give it back to you. I'll give it to Joe. Joe, if you have any other thing, then we can give it back to make it.
Yes, sir.
Then we can talk a couple of things here. How we can maintain tomorrow's show, and who we can be, who are we expecting as our guests on entrepreneurship and small business in our district. So thank you again, Joe. I gave you the gavel back.
Wow. So thank you. Even though I had a break in and coming on, but I think tonight's show was very much fascinating and great
Right.
to have Mr. Jaga Beningoto on this platform is indeed a boost for us in our district because he have a lot of understanding when it comes to health matter. And CEO, it was shocking to know that this young man is also versatile.
Yeah,
Yeah,
I know
he
that.
have
And he got too much passion. The passion too
just
much.
trust me, I've known him to be a medical person, but not extensively as he elucidated or he expanded on the topic this evening. So I'd like to give it up to him. Maybe not only Tuesday, in fact, we can even get him on or on all of the segment why he handled the Tuesday show. Yeah, that's what
Right.
I wanted to say because yeah, he have more that we can get out of him. If he's less busy, he can join us.
But honestly, that's the kind of people we need on the show. People like the commitment, the passion for the district, the passion for Liberia. Because all we do here is progressive movement. We find a solution, and we like example. He spoke about all of that, the recommendation of what I said. Since you partner with D14 in this, we need to I will design the letter, send it, we'll do the letter, you and I, and we get it out there. It can be signed by Lawrence, and you also we get it to the commission to see how well we can establish. And we want to have the commission on the show anytime from now. Bedu is working on that, so we don't know how far Bedu have taken that other level. So let's give our brother Jack the opportunity to do his summary. Then we can do internal
Yeah.
conversation. Maybe he can stay and find. Maybe we can all can sit there and find solution.
Okay.
So thank you again, CEO, and thanks to Joe Binu, to Adama Sanon, to Melvin Brown, and to my own people, Lawrence family. So I'm grateful again, and I will always want to come to give my all into this. I was birthed in District 14. I did everything, all the education I had was right in District 14 when I obtained it. So looking at our district crumbling, where we are in this molding age, sometimes it hurts. But however, I want to also give it up to you, CEO, for this initiative. And one thing I want to assure you on, by the special grace of God, we will make sure that this platform will not fall.
Thank you.
This platform will be elevated to the best of the ability to resolve some of the major challenges we have in our district. Because if Liberia must develop, if Montserrat County must develop, many other water, the development should start from our own district. So I'm pleased, I'm happy anytime working with you
Thank you.
on
Thank
these
you.
basic stuff that will help to eradicate or to reduce those dependency syndrome of our citizen, to continue to be looking at politicians to do this, politicians to do that. Whereas we are here, we having the innovation to create jobs, to work with local institutions, to even have health center to be erected, we even have the government even coming. We can do that, we can work towards it. So I want to say thank you. I'm happy by God's grace. I will always love to be around. Thank you so much.
Thank you. So thank you so much. Right now our time is 7 to 9 p.m. We're looking at things if we adjust it. The reason why you always see me here because I reduced my contract and I'm hoping to be Liberia very soon to put the physical structure down and make sure we do intense awareness and encourage the young people. I hope I got money where in that every local every local intellectual center we can have a TV while we carry on the show that it can display on the TV and the watch. They use their phone to make input. And getting internet is one of the toughest things. It's not something I can even manage for the longest, but that's something I want to do because we need to educate each other. We need like the teacher, the entertainment center. We make sure as soon as time can, they just take it as a something and they just make sure internet there, connect the TV, everybody watching what we're discussing. That will help a lot for us. And I hope let God strengthen me and be able. And I said this to every other persons the whether BA on Omuka, my brother John Sylvester, Emmanuel Ban, and our ma Polly, and my sister, and Massa Dopo, and those that are intended to contest 2029 to come and form part of the show. Let's contribute. I don't want to be seen as the guy in the picture. I want to be seen like a collective effort, what we can do to make like it's about our people. And I think we got to do everything possible in order to soften a lot of stuff that needs to be and educate our people. They're not supposed to be seen as a demagogue, rather people that serving them purposely for the cause, the needed cause. So I will encourage now. I was saying this: if you watching, encourage your leader to come here. Let's talk. Let's laugh, right? The people of District 14 are the decision maker, whoever they want. But every leader, whatever way we can strategize in order to help all the sectors we targeting in the district will be better. And like example, I spoke about like the issue of the breaches. We do no longer need like the wooden breaches. We need cement, concrete. How can we do it? We try to invite the young people every Monday. We see Joe and I, like Joe got a fun time again. Let's talk early when I get up. Maybe after the show. Let's talk who can target, who can be on the show. Monday we want like 6 young people here with strategizing and getting ready. If anything, we're going to invest. We even get an entertainment day. Saturday, since Joe, I don't know. Saturday, since we done with LRB pastor, and we haven't gotten because he said we should host a workshop. I'm waiting to try and facilitate the workshop, but he needs to come back with plan. We need Abraham back because the thing is that he said the artists and actors. He said the artists and actors. What I see among them is this organization. We need to sensitize them because as soon as they start thinking one small song, the only thing they start chasing chicken chin instead of building a career. When you call them somewhere, everything they just want chicken chin. We got to change our mentality. We got to expose them to the international market. The kind of music they need to make, the kind of community they're supposed to create. Where when they in Nigeria may listen to it, at least they can understand a little bit. The Ghanaians, they are voting because our population is not large. And two, less than 30, I think 38% or 37% people have access to smartphones. So in order to reduce that, we need to find strategy for us to sustain our district. And if we can maintain, then we can start bringing other people. We can partner with district. 15, we can partner with district. 7, we partner with our local district, and we have to collective development. So thank you, Joe. It's up to you. Tomorrow's show gonna be entrepreneurship, and we need if you can even go to Haja, you bring Haja to talk about how she sustains her business, how she manages. Let other people hear it, right? We gotta go to the market superintendent. Let's bring it on the show. I'm begging your business. I hope business
Yeah,
here
okay.
bring the people. Let them get used to this, right? If we even
Yeah.
credit to
Certainly,
that,
CEO. Yeah.
but let them sacrifice too. Thank you.
Yeah. Thank you,
CEO.
CEO. Thank you. Yeah. So, CEO, let's talk at the back.
Yeah. So you can make your parting statement and we can close. Yeah.
Yeah. So, I'd like to appreciate you again for this show tonight, for the way you handle the show. The lead panelist is not here, Lawrence. The host, he's not here. So I'd like to say thank you for conducting the show. Look, CEO, I was talking to a few young people about this platform today, and they asked me who created the platform, who do this, who do that. I said Chester created a platform, and some of them look at me and say, "But Chester said you're building radio station." he offered fake thing. I said no. Something have to start from somewhere. And that's the reason why we're joining him to help me or make this successful so that we can get that radio station erected and in or full function. So many young people they have to understand on what we are engaged into and where we intend to go in a few months or year to come. This is an investment that needs to be appreciated by every one of us young people. If somebody is doing this, we have to appreciate them, to encourage them to do more. It, it, I told them that you are paying money to to keep this running every month. And they didn't believe it. They just feel that free thing we're doing. So again, I'd like to appreciate you for keeping this moving on and for the betterment of our district. I know in subsequent time or days, weeks, month, and year from now, we will start boasting of our own radio station where young people will come and give their input when it comes to development, healthcare, and other meaningful things that we want to discuss on this platform. So again, we will try our best as possible to bring those best brain on this platform like we did with Jack Beningo too. We'll
Yeah,
try
proud
to
of that.
bring some other young, yeah, we'll try to bring some other people on the show tomorrow. And I just like to say thank you to Jack because it was just this afternoon I placed a call to him. And he never hesitated. He said, "Yes, I will be on the show. Just share with me the topic and the link if the time reach." Just like that. There were no headache. So I just like to appreciate him and consult other young people out there to be like him and join us anytime we call upon them so that we can make our own district platform a better place or to educate our citizenry and the young people of this district. So thank you so much, CEO, for the opportunity once again.
I appreciate that. Thank you. We are about to close. Let me just make my party. Benuko, is there any other thing?
But Beningo is still around.
Nothing major, Chief.
Okay, thank you. Once again, thanks to everybody who watching from out there in the district, more precisely to D14 public broadcast service talk show. Every day we have specific topic and we inviting guests to speak on these issues in our community. For now, that our people can be able to understand what are some of the issues we see as challenges and how we can resolve it. This is open to everybody, whether your religion, your political background, your affiliation. This is T14 own property. Like Joe just said that some of the young people think are on scam, other things are supposed to build radio station. The thing is that our people got to understand that everything changing today. Traditional radio stations are not effective as to this, especially I know most of them who saying it are those that in entertainment. You can go to a radio station and go talk, people pay from there. But when you talk, you have their own media platform, you get paid from there. So our people have to come from the traditional understanding to the digital understanding. In as much I have in mind putting a traditional structure down, we might utilize it because they pays more and people listening more on this than both local and international than the local they do expect. If you can't even manage,
Right.
if you can find idea where to come and make money, how we can teach you how to make money as artist and actress. If you can come publicly for polo listening, how many people will be able to listen to you traditionally? Right now, you go on Spoon, you find thousands of people who have access to internet, other thing, and you go to how you call it, and other social media platforms.
social media platform. So,
So we have to utilize
so
the
we have to
again,
utilize
the young people in
the,
the take
the
everything
young
for
people
fun.
in the take
So
everything
we
for
will
fun.
keep educating
We
them. This
will
is the
keep
essence of
educating
AIDS
them. This
media
is the essence of AIDS
center.
media.
We will keep
Center will
educating them.
keep
We will keep
educating them.
patience.
Will keep
If
patient.
you mind a statement, some of us
If
would
you
have
want
been
a statement, some of us
exhausted
would
and
have
just
been
sit on the back
exhausted
and
and
not
just sit on the
focusing,
back.
right? Because we can do every
Right?
other thing
Because we
extra
can do
politics,
every
but
other
our
thing on
community
our
matter
community.
most. So you guys are welcome.
So
Let me
you
attend
guys
this
are welcome.
status. Let's
Let
do
me think
whatever
this
we can
time.
do.
Let me
Like
whatever
our brother Mr. Abenigo said that we'll pray and we'll work hard to maintain this platform because it means a lot to our district. And it encouraged me, impressed me more, and it gave me the energy. And the good thing is that people like Joe and Benu keep maintaining us and keep giving me the courage. Look, we can do this, and this is going to be big. And it shows that, look, Chester, you got to do more in order to maintain the platform. So thanks for everybody who watching. Thanks to District 14, and thanks to the guests. You now will discuss in the back, and you're going to be a full contributor, and we'll add you into the chat room as well, so that you can be a contributor. Let's make our district possible. Let's do everything that will keep it moving, and let's make everything possible that will bring changes to our district as well. Thank you, Joe. Thank you, Beningo. Thanks to the host, Lauren, in as much she's not here. Thanks to Baby. Thanks to Sana, who always here on the show. And thanks to Melvin, who are taking this as a usual habit to be part of this show as always. And Samson, thank you always for being around. We appreciate you, and we would like for you to fully participate on the show and make your contribution as one of the panelists as well, because your background is in journalism. And thanks to my boy Charlie. Thank you for always supporting Evangelist Charlie. I do appreciate your support in every other way. Thank you, Mr. Sokando. Then Austin, the General Austin, and thanks to Foba and yeah, who always on the show and following as well. So we close for today, and we hope tomorrow we're going to be discussing business and entrepreneurship. Thanks to everyone. Bye.
Thank you.
Thank
See
you.
you.
And
Okay.
then we get.
Thank you, Theo. Thank you, Theo.
Thank you, see you.
All right.